Right, looks like we can get started. Ladies and gentlemen, thank you so much for joining us today. I'm really excited to start this incredibly interesting and important discussion. Um, it's titled Exploring Innovative Solutions to Address Critical Health Needs for Women in Conflict Settings. So it's a bit of a funnel of topics, but I think it's incredibly crucial to tackle this at this time. I'm looking forward to setting out the challenges ahead of us, but also hopefully leaving everyone in this room with a short list of strategies, approaches, innovative solutions that we can implement now or in the near future to help as many women and girls as we can. I'd like to now introduce His Excellency, Mr. Khalifa Al Thawari, Director General of Qatar Fund for Development, and he will help us start off the discussion with the keynote speech. You're welcome to join me on stage. Thank you.
Assalamu alaikum. Excellencies, distinguished guests, ladies and gentlemen, let me start by thanking you for joining us today as we gather to address a topic of utmost importance, women and health. Health is a global concern, touching the lives of each one and every one of us everywhere. It is a fundamental human right encompassing the right to availability of proper health care, the right that healthcare facilities, goods and services are accessible, the right that they are ethically and culturally acceptable, and the right to equality healthcare. Yet, inequality and discrepancies persist in women's health. Women, for instance, still die from preventable problems during pregnancy and childbirth. They are consistently diagnosed later than men, and the disproportionate impact of the life of women and girls caused by conflicts, disasters, and pandemics is evident. The rising inequalities in health continue disrupting lives and livelihoods, most particularly in conflict, fragile, and emergency setting, where the right to health is continuously violated. Gender disparities also amplify women's vulnerabilities toward infectious diseases in low and middle income countries, exacerbated by poverty, violence, educational inequalities, a lack of empowerment, and a lack of access to basic services. Despite commendable progress made, millions of women still grapple with inadequate access to healthcare. Ladies and gentlemen, meeting women's health needs, uh, meeting women's health and improving gender equality is not only a moral imperative, but an all-around smart solution for individual, societies, and economic prosperity. A woman's health lays the foundation for her children's health, her family, her community, for generations. In stepping up its work against gender inequalities and promoting health for all, Qatar Fund for Development has demonstrated a remarkable commitment toward addressing infectious diseases with an emphasis on advancing women's health. Since the establishment of Qatar Fund for Development and the commencement of its aid provision in 2012 until November 2023, the QFFD has contributed around $1 billion to the healthcare sectors in more than 55 countries, particularly in Middle East, Asia, and Africa, as well as to many other entities with whom we have collaborated in the health sector. These funds have been strategically allocated based on the urgency of each country, reflecting a profound understanding of the vital role that robust healthcare systems play in saving lives and reducing infectious diseases. The QFFD believes in the transformative power of a strategic partnership when addressing health challenges globally and comprehensively. We are particularly proud of our collaboration with the Global Fund, Gavi, and the WHO, just to mention a few. by prioritizing initiatives that specifically target and address health disparities faced by women. Qatar Fund for Development contribute to creating more equitable and inclusive healthcare system for all. This is also in line with our Women in Conflict Zone initiative that guide us in our efforts to ensure that health needs, in particular in conflict settings, are not only recognized, but also effectively addressed through collaborative efforts. We also believe in the transformative power of technology and innovation. For instance, telemedicine. And improving access to quality health for all, telemedicine has proven to be effective in providing faster, more efficient, and cheaper delivery for healthcare without the constraints of time and distance, which can be particular relief for women. To conclude, I wish to thank our partners, the Global Fund, for co-organizing this important and timely panel discussion. Becoming a more impactful in our effort toward improving health outcomes for women and girls depends on the learning from our past experiences. It depends on learning from each other. This is the purpose of our discussion today. Rest assured that our commitment toward gender equality, women's empowerment, and addressing health inequalities for women remains steadfast, always remembering that healthy women are the cornerstone of healthy economies and society. Thank you.
Thank you so much, Your Excellency, for those opening remarks. And before we begin our discussion today, we do have a video from the Women in Conflict Zones initiative that Your Excellency spoke about just now. We're going to play that first, and then I'm going to introduce our panelists.
Because of who we are, we get caught up in war in ways you can't imagine. Abuse, killings, torture, abandonment. We even fear getting our feelings. We have no place in the peace process.
The same has been true in almost all wars and conflicts in history.
But they look to us for things we've always done: care and domestic responsibilities. Under stress, loss, uncertainty,
From pain. Do you have any idea what that's like?
Didn't think so.
Did you know you have a better chance of peace when we're involved?
Didn't think so.
This is what it's like for us.
The conflict,
Genocide. We suffer more than you.
somehow, we go on with it.
So know us. Hear us. Because we need you.
And you need us.
Qatar Fund for Development, alongside its strategic partners, empowers women and girls in times of conflict through humanitarian aid and developmental assistance.
I don't know about you, but that was very moving. Nearly brought me to tears. But we are a resilient bunch, us women, I think. And I'm really proud to be part of an all-female panel today to discuss this incredibly important topic. Just introduce myself. My name is Sandra Gatman. I'm a journalist and presenter at Al Jazeera English. My expertise is not conflict resolution or humanitarian aid, but I'm here to guide the discussion and learn from everyone, from all of our distinguished guests, and hopefully we get a conversation going. So we're going to have about a half an hour discussion on stage, and then I'd like to invite you all to pose questions to our distinguished panelists. So without further ado, I'd like to introduce our speakers. We're joined by Ms. Lady Roslyn Morata, Chair of the Global Fund Board, Dr. Hanan Balki, Regional Director-elect for the Mediterranean region at World Health Organization, Ms. Sultana Afdal, CEO at World Innovation Summit for Health, otherwise known as WISH, at Qatar Foundation, and Ms. Rosella Micio, President of Emergency. I'd like to welcome you all onto the stage. Round of applause, please, for our group. And I believe they're on. Fantastic. Thank you so much for coming to Doha for this high-level side event. I wanted to sort of set the scene a little bit, and I know that His Excellency and that incredibly powerful video did a good job at delivering the message of just how important this conversation is. But I had a friend ask me this week, why the focus on women and girls? Because in conflict settings, bombs, as far as I'm aware, these were her words, don't discriminate. Diseases don't necessarily discriminate. And yet, all I could think of was women and girls are just more vulnerable. But there is so much more to that. And I want to start off with you, Lady Roz. Why is it important for the Global Fund to focus on women and girls in conflict settings? Why does it pay off to do that?
Thank you, Sandra, and good afternoon, everyone. The Global Fund just doesn't focus on women and girls in conflict settings because, as His Excellency Al-Kawari very clearly said, women are more vulnerable to disease, disproportionately affected by disease in any situation, but in conflict situations, even more so. So, in those situations, all the existing gender inequalities are even more pronounced. Disease in ordinary settings affects women more disproportionately to men, and particularly young women and girls with HIV, for example. In sub-Saharan Africa, girls between the ages of 15 and 24 are twice more likely to be infected than boys of the same age. And we've learned that unless you put gender and human rights at the center of all programs, they're not going to be effective.
Could I just interject there? Why are girls more susceptible to the spread of HIV than boys?
Generally, the power imbalances and the socioeconomic reasons why many of them will be having sex.
I think it's important to know these things, and your work is incredibly powerful. You're not just trying to eradicate HIV, but also malaria, tuberculosis. What are some of the conflict zones that you focus on?
Well, we don't focus on conflict zones. We operate in over 110 countries, 120 in fact, but 30% of those are actually what we call challenging operating environments, either affected by conflict or very weak governance or emergency situations as a result of climate change and climate disasters. And since our beginning 20 years ago, we've spent more than 20 billion in these countries, even though they represent only 14% of the global population. Those countries have 30% of the burden of HIV, TB, and malaria. And if we just take malaria in a conflict zone or not, women and children, there are more deaths in pregnant women and children than there are in other sectors of the community. A child dies from malaria every minute.
Wow, that's an incredible statistic. Thank you so much for starting us off. Hanan, I'd like to continue with you. I've just learned a couple of minutes ago that You are the first woman in your position as head of the East Med at WHO as a regional director. So that's fantastic news to start off, because I think when tackling these kinds of challenges, we need women at the helm. I just wanted to familiarize ourselves with what it is that you focus on and how you try to keep women and girls, and how you will intend to keep women and girls at the heart of addressing health needs in conflict zones.
Thank you. Thank you very much. And it's a pleasure to be here. And I'd like to extend my appreciation and thanks to the State of Qatar and QFFD for all the work that they've done and hosting us here today to talk about this specific topic. Indeed, I think women health issues need to be managed in a holistic fashion. So being a female is definitely a plus, but I think it's a whole of society response to take care of everybody at all types of diseases. So the WHO's mandate as the global health leading agency is to ensure health well-being, but also mental and social well-being. So it's not healthcare, it is the health agenda that we aspire to address. The Eastern Mediterranean region, just to orient people in the room, is made of 22 of the 194 member states, and it encompasses around 750 million people. So you could say plus minus 50% of that are women or female gender. The one of the reasons, and by definition, just to identify myself, I'm also a pediatrician, infectious diseases, who has worked at the healthcare setting for 20 years in my hometown after I completed my training. And I've been leading on AMR in Geneva for 4.5 years now, the antimicrobial resistance agenda. So I think one of the things that we're facing in the health sector is health, and we've seen that vividly in COVID. Health does not take the priorities of head of states usually, unless it's linked to economy or to the impact on economy. And I think that's where the health sector falls short because lack of data. So if you go down one step further, when you want to address and promote research for issues that are relevant to women and children, and you don't have the data on the burden of the topic or the disease, then you won't be able to fundraise for the topic. So one of the issues that we also face is the lack of data, and then the lack of disaggregate data. So how much of the burden of Lady Rosen gave us some great data and percentages, because Global Fund does a great job. They're very focused on the areas that they work on, but many other health agendas does not have the wealth of data that we need to mobilize money, to mobilize research, to have focused, directed health sectors for women and for children. So I think one of the things that in WHO, what I've learned that we're doing, we're building a plane, flying a plane, renovating the plane as we're moving along. So we're trying now to work with our member states to ensure that we can produce good data. That becomes, we can maybe in the innovative section, you might want to address that. But there's a lot that needs to be done. My focus when I do take office on February 1st will be to ensure that we do help our member states to institutionalize the resources and the interventions that are needed to improve on the health of women, children, but men and elderly and the whole communities. I'll stop here because I can go on for not too long.
And I think it's an excellent point that we should come back to, because I know that, data is the way we look at gaps, we identify gaps and then address those gaps. Sultan, I want to find out from you. WISH is all about innovation. So what are some of the initiatives that you'd like to share with us today that that relate to women in the health sector? No. Let's try another mic. There we go.
I think you can hear me now.
Fantastic. Thank you.
Yeah, if you forgive me, I'm going to veer a little bit away from women and talk about children a little bit more, especially as
Also important.
given the armed conflict and the focus on plight of children. So many of you probably know the World Innovation Summit for Health is an initiative of Qatar Foundation. It's a global health initiative. So what we do in a nutshell is convene every 2 years academics, policymakers, heads of state, ministers, to really look at the most pressing global healthcare challenges on a neutral platform and look at innovative, cost-effective ways of tackling those. What we did recently, we're hoping people have noticed, is that we signed an MOU with the World Health Organization last week for Wish 2024. And one of the focuses is going to be armed conflict and protecting health and healthcare workers, and obviously children as well. So I'm going to go step back a bit to the 2018 WISH report because it's interesting in the context it provides, given that it's only 5 years ago. So one of the things that the report, Health in Complex Settings, did was create a framework of principles to guide health actions in conflict settings. This could be new technologies, new forms of information gathering, new ways of analyzing. And one of the focuses was violence against health workers, or the 70% gap in funding provided that wasn't adequate. And I think one of the things that really the report did focus on was, despite people living in conflict zones, children still need protection. They still deserve a modicum of healthcare, right? And so this report, the thing that this report recommended, which was, I guess, innovative and it still remains so for me, is focusing more on getting funding to healthcare workers, a more localized approach. So 25% of the funding would go to them rather than institutions or external stakeholders, because they can really foster innovation or utilize that money where it's most needed. And so I'm kind of saying this because I'm going to pick up that point in a minute. And so the other thing that was really interesting was the initiative that it highlighted in 2017, which is the WHO Attacks on Healthcare Project, which actually collects data and analyzes it in countries, and then it verifies that data. And that data is now found on the WHO online platform, and you can see what's happening. And one of the things that is really incredible and disappointing is the unprecedented rise in attacks on children and health and healthcare workers over the last 5 years. So if you're thinking about figures in terms of protecting children, 170 million children lived in high density crisis conflict zones. 5 years later, it's 240 million. So 170 million to 240 million is quite a rise. So I think with the increasing violations of human rights laws and conventions, how do you kind of innovate in a space like that? That space becomes extremely constricted. So now our focus has become recently, especially with Gaza, how do you find innovation in small spaces and try to save lives? Because right now there is no delivery where NGOs, WHO have a very restricted access to, first of all, administering healthcare. What can we do in terms of saving lives or helping people? And so a couple of years ago, we were very interested in this. I'm going to be brief, as brief as I can, because I know people are curious about my part. I have to give context. So several years ago, we actually realized that there was a really interesting program called the Pediatric Blast Injury Manual. The innovative thing about this is that it studied blast injury on children, and that had never been done before. So how do you account for the size of a child, what happens to him? This traditionally had only been done for soldiers. So when this was produced, we supported its translation. It got translated into 7 different languages and was used in Syria, Ukraine, most recently, and Gaza. The problem, as I said, I'm coming back to this now, localized healthcare is where the solution is. And it's not even localized healthcare workers.
Yeah.
It's how do you enable communities who often don't have healthcare workers to help themselves?
Yeah.
And this is where this kind of card came in. Because the blood.
Show us the card.
Yes. It's actually called Stop the Bleed. So any layman, so this is the first page.
Okay.
Any layman who is in a zone where a child is injured can use this, and this shows you how you tourniquet. And this is actually, because in a war zone, one of the biggest preventable ways of dying is actually bleeding out.
Bleeding out. Yes.
So Stop the Bleed is the card that we've developed recently, translated into Arabic, and have actually just taken over the borders to Gaza. And again, innovation in very small windows. How do you do it? And how do you enable now, in a very constricted zone where healthcare workers have a very limited capacity to make a difference when medicine doesn't exist to save lives and you have to enable communities. Again, stopping here now.
No, that's fine. You're raising an incredibly important point because this session is all about innovation. But in a conflict, you know, especially where you've been, Rosella, in Sudan, very few parts of Khartoum have electricity. So when you're talking about offering things like telemedicine or other high-tech innovative solutions, we have to go back to basics, right? So could you just share with us some of the ways maybe you've had to think out of the box, or how your partners or you yourself at Emergency have had to think out of the box to, as Sultana was saying, empower local communities, health workers to care for women in a conflict zone?
Thank you very much, Sandra, and for inviting us also to the Qatar Fund for Development. It's it's a continuous challenge, and it's never the same. I mean, next year we celebrate our 30th anniversary of emergency, so we started 30 years ago. And I have to say that unfortunately, when it comes to war context, the situation did not improve over the past 30 years. Actually, and Sultana was absolutely right, there is more and more limited access in war context, and this has been a huge challenge for us to try and deliver healthcare, particularly when we believe, as His Excellency was saying before, that healthcare is a basic human right and has to be provided with quality and without any discrimination. So we've been trying in many different contexts to meet the different challenges. For example, in Afghanistan, we've been there since 1999 in 3 different areas of the country. And in each area, the hospital looks a bit different, but at the same time, you need to have the same approach that particularly when it comes to women and children, is very critical in that situation because they are very vulnerable, but at the same time, they can be, particularly women, a big resource for the community. So for example, in Afghanistan, where we do have a maternity center that is helping to deliver approximately 700 babies a month, all the staff is made of women. Some of them are also coming from rural areas where initially it was very difficult for the community to understand why a young girl should move out of the house and go to the neighboring province and work there. But when they realized that they were not just delivering care to the women in the hospital, but they were also gaining skills that were going back to the communities, gaining a salary that was supporting the community, these girls, they become the leaders in their own community. And they started to develop within the community their own programs for community health workers to support women's healthcare. The same we are trying to do in Sudan now, where the situation is really scary. Over 6 million new internally displaced people since April. Khartoum is a city under siege where more than 3 million people are still living there. There is no electricity. There is internet connections and mobile connection is very, very weak. But at the same time, providing the continuity of care and involving the local communities that are really struggling with us to keep the hospital open has proved to be a key for the, let's say, resilience of the health services and of the community as a whole. But
And I imagine in Afghanistan, sorry to cut you off, it's particularly important to rely on women in local communities because of that recent directive from the Taliban, right, to ban female NGO workers from becoming those access points.
this is something I'm very proud of. I mean, because we were always involved in training and empowering also the female staff. So we do have school of specialization, not only for gynecologists, because in that field of activity, fortunately, at this stage, women are still allowed to work. But for example, we do have also a residency school for intensive care and anesthesia and intensive care And we do have among the specialization students, 2 women, think about it. And we're still struggling with the local authorities there to make sure that they understand the importance of reopening the possibility for girls to go back to school and then to grow, not just to primary school, but really to grow in their knowledge. It's a big challenge, but again, by working side by side with the community, I think that the role of international organization is really not to want to go in, bring in, I don't know, whatever, super sophisticated and then move away, but it's really to stay nearby the local community and help them to be heard and to be more effective in their own in meeting their own needs. This is what we're trying to do.
Sounds like you're doing a good job. I wanted to open up a question to all of you, but I know Lady Rose wanted to chime in. Go
I just
ahead.
wanted to take up the point made by Sultana and Wazir that the importance of involving women and young girls in their own programs. It's not something that you do for them or focus on. Programs that women and young girls are part of the design, part of the implementation, part of the monitoring, are far more likely to succeed than a general health program.
Yeah.
I think it's a really important point. We've seen that in all countries, that you have to hear what they want and tailor the services to their needs.
Listen to women, basically.
On all things.
On all things. It's always very wise. One of my questions is, when you're looking at a conflict and the needs are so great, life-saving aid is the priority. For instance, in Gaza right now. I was watching a very renowned Instagram blogger. I forgot her name. It's Bisan Oda. Maybe some of you know her. She's extremely popular on Instagram, and she's always blogging about the daily suffering of Gazans right now. And the other day, she posted a video, and it struck me because she said, we shouldn't be shy about talking about this, but why don't we have access to clean water, sanitary products? There are, hundreds of trucks coming in through the border, and there are no sanitary pads for women. And she said, we shouldn't be shy about talking about this, but this is so important because not only are we suffering so many layers of violence, you name it. We have this additional suffering when it comes to having this lack of dignity, but also this real risk to your health as a woman. How do we make sure that we address those women-specific health needs in a conflict? I don't know if anyone would like to chime in here. Sultana, go ahead.
Yeah, that's an interesting question, actually, because I don't know if you know Street Child United, but it is for homeless people, and it's a competition that's usually held before the World Cup. So it really celebrates people who are homeless, and their motto is, I am somebody. So they approached us with a project in Palestine where you could build for quite a modest sum a small factory using scrap paper to produce sanitary pads. And everybody who was in the factory was always a boy. And so they also had an education pack for the boy, because when he's building this product, he also understands the purpose of it and the need within society. Now, unfortunately, that program got shelved because the funding was there, but because of the war, we're hoping to do it later. But I think, again, sometimes enabling them or building the infrastructure in the country where you can enable them. And also, there's a message here, right? Because in some ways, women suffer a lot because, or girls do, because they cannot articulate what it is that they need. And in terms of this, you're educating boys, you're creating the awareness, you're creating the sustainability as well.
Yeah. So, moving on from Lady Rosa's point, involving women is important. Involving boys and men is also hugely important. Go ahead, please, Hannah.
Maybe I'll just add a few things. I think it's not, sorry, if you want when we talk about, I mean, the video was very emotional, and I think the discussions today are extremely difficult. And I think the addressing women issues and girls is not just in the conflict area, because we need to start doing that before. So then it becomes easier in the more difficult situations. So we don't even have the basis of respecting women's needs when it comes to the regular work. I remember when I have two older boys now, but when I was pregnant and breastfeeding, it was almost like I was ashamed that anybody would know that I'm breastfeeding. And when I was 8 months pregnant, I was doing rounds. I was on call in the hospital every third night, and my feet were aching on rounds, and I was embarrassed to sit down because I didn't want to be seen as a weak person. And it was one of my mentors who said, "Let the pregnant lady sit." And not being embarrassed about it. So when I became a consultant and I had pregnant residents and doctors or nurses, I would do the same. So maybe I'm personalizing this a little bit, but I think that it's the mindset. Is it shameful to have your period every month? Is it shameful to say you're having stomach aches and back aches? Is it shameful to say that I need 30 minutes to go and pump? Is it shameful to say that I'm having cramps at night? Because at the end of the day, when you build those women, and I tell my junior public health nurses, the women, the girls, that don't deprive yourself from your motherhood, and make sure that you invest in your maternal instincts and taking care of your children, and the career will continue. So I think having that, and not shaming women for taking leave because they're pregnant, or so we need to speak about those things openly.
Yeah.
And then in putting the kids together and putting the support in either in the hospitals or in the conflict zones, we need women sitting at the table to look at those lists of how do we compile. A lot of young girls miss out on education because of their period. Okay, I mean, so we don't want to get too uncomfortable in this room by giving too much detail. But if we were only women, then we would be saying a little bit more. But I'll stop here. So I just wanted to reflect on those things.
No, I think that's a fantastic point, and you're doing as you sought out to do, which is to talk about it. So it's important. I'm going to open it up now to members of our audience. We're going to have a quick Q&A session. If you could keep your questions to questions, I'd be really grateful, and let me know if you are addressing them to any specific member of the panel. Please go ahead. The mic. Yeah.
Okay, thank you. Thank you for the lovely session and nice to hear from these amazing ladies. I'm gonna be talking about a real case, so I hope you will not cut me off. And yeah, thank you, Sandra, for mentioning about access to sanitary pads. And I think there are a lot of issues that we haven't really talked about when it comes to access to healthcare for women in conflict areas. And I have a question about a related points that we normally do not talk about. So I'm from Ethiopia. So I want to talk about the high number of rape cases in conflict areas. Now, as we all know, rape has unfortunately been a long time, have been practiced for a long period of time as a tactic and a weapon of war. And sadly, as we all know, the consequences has a long-term impact on women. However, correct me if I'm wrong, but I think we don't really see that there's an in-depth discussion that is going on, critical issues that are related to sexual violence as a weapon of war. For example, in the war that happened in the northern part of Ethiopia, women were raped, some got HIV, and some got sexually transmitted diseases, and some got pregnant and had to deliver the babies because hospitals were destroyed because they were targeted, obviously. So as a result, most women were named ashamed, and some were forced to leave their community, and they got excluded. And that's why, by the way, currently Ethiopia has more than 4 million internally displaced persons. And that's why also most Ethiopians are forced to migrate and leave their country because they feel ashamed. And that's why most Ethiopian migrants migrate irregularly, mostly to the GCC, not because of only economic gains, but mainly to seek safety. So my question is, how can we explore practically effective, innovative solutions to address these untouched issues, especially in patriarchal societies where raping women has been sadly normalized as something that just happens to women because they're women. So where and how do we start? Because I think the law has obviously failed us. I'm a human rights law lecturer at one of the universities in Ethiopia that sadly says that the law has actually failed us. So please help. Thank you.
Thank you very much for your question. Rosella, perhaps you'd like to speak about that. I know that,
It's a big issue, gender-based violence.
Yes.
I totally agree. I mean, it's really becoming more and more a weapon of war, and it's used everywhere. We are seeing it in Sudan right now, but we've seen it in the past in Afghanistan, and we see it in Italy because we do have a search and rescue program. So we have a boat, and the stories that we heard from these girls, many of whom escaped from violence in their own country, and then they have encountered again and again violence in along the way. It's a big challenge because it's not just related to health care, but it's really related to how the community can support the ladies, the women that have gone through this. There is still a lot of stigma. Still, women have many problems in dealing with the fact that they become pregnant. Maybe they don't want to keep the baby, but they have to because of the community, because of everything, and then this would be a burden for the entire part of for the entire lives. So I think that in this context, what we're trying to do when we face this situation is to combine both, let's say, the physical healthcare activities with psychological support, which is very critical and really underestimated, I think. But also, as Hanan was saying before, really trying to make sure that the physical violation does not become a stigma for the rest of the life of the woman. It's very difficult. It happens also in Europe. We have seen it with a lot of girls from Ukraine that were going to Poland and they could not access to a safe abortion and so on. So it's really very complicated, and this I think highlights how still to be a woman has a very strong implication in your entire life. So it's we are equal in terms of dignity and right, but unfortunately we are not equal in terms of how conflicts can affect our own lives.
And there's the added stigma, isn't there, when it comes to women who are victims of rape, but also, having been infected by HIV, perhaps.
Yeah.
And there's the aftercare and,
Yeah.
Educating, protecting that woman and
Yeah.
kind of mitigating the spread as well in that community. I imagine that's a big focus.
It
as well.
involves a lot of men as well.
Yes.
This
yeah.
is really something that when we talk about innovation in women's health, I would say that it has more to do with the behavior and mindsetting. So the involvement of the community of men by the first, than to perhaps technology.
Yeah.
Yeah, it is a huge problem in conflict settings, but as you say, it's a problem in all countries. But you said earlier that you wanted us to have some rays of hope, not leave too gloomy. So I just want to talk about a program that we fund in the eastern part of Congo, in Bukavu. There's a hospital there, the Panzi Hospital, run by a wonderful Congolese doctor who actually won Nobel Peace Prize in 2018. And they provide very specialist services for women and young girls who've been affected by sexual and gender-based violence. Many of them have HIV. And we're providing all the treatment for that hospital. So yes, it's terrible, but we have to see what we can do and support any efforts to tackle this.
And it's great he got the recognition for that as well. Would anyone else like to ask a question? Yes, please go ahead. Do you have a mic? Great.
Thank you very much to the panelists. My name is Dr. Frida Njogu. I'm a medical doctor, but I also work for ID Insights that looks to provide data and evidence support to, government, nonprofit and other leaders to make the decisions more rigorous. Dr. Hanan alluded to the lack of data, lack of disaggregated data, lack of useful data for decision making. And I just wanted to hear, are we having any thoughts around, especially during conflict settings, on your usual, passive surveillance systems, are disrupted when you're not able to get your usual administrative data. Whether we are exploring other systems, like satellite imagery, AI and machine learning, natural language processing, using chatbots to just collect data on what is available in the community, what the community is experiencing. We and others have used this kind of data to help in various programs, whether it's WHO and other partners. Are they actually utilizing some of these, probably more available, or probably more feasible systems in these disrupted areas, so we're able to see who's moving where, and here, what are the communities saying, what are they talking about, and so on, to identify the gaps and maybe plan for interventions. Thank you.
Go ahead. Yeah, thank you very much for this specific comment. And maybe it would be great. It was an eye opener for me when I had to present to a specific group about 2 years ago in Cairo. It was for the Religious Authority of the Islamic World. So about 91 religious scholars were there. And we talked about the role of religion in progressing on the SDGs. So it took me away from my AMR, antimicrobial resistance world, into a very different deep dive that I had to do. And you're probably familiar with the SDG report on women. And that specific report, I found it has a wealth of information on what exists and what doesn't exist when it comes to data on women issues. Of course, the WHO has a strong and growing, actually, digital health unit under the newly established science division. So the World Health Organization is taking this area very seriously and trying to build on tools that will enable and help us in helping our member states in developing their resilient health systems. Again, without those types of tools that are accessible and produce valuable data, again, we're not going to be able to push any of the health agendas forward. So I think that, there's that reference might be helpful for you. It's helpful for all of us to move forward, but there's still a lot of work that we need to do in collecting data. One last comment is that when you're in a conflict zone and when you're in an area where you have to prioritize, do you prioritize the resources to solve the problem, or do you prioritize to analyze the problem? And we have that issue with many health topics where, you're in the middle of a conflict, and then if you see the people who want to collect data, they're like, people are dying here. If you have an extra set of hands, this is what we need to do. So how are we going to innovate in serving people and then collecting the data? And that's what I always focused on, being patient or person-centered rather than data-centered. So maybe that creates a paradigm and an anti. So hopefully we will be able to solve some of these problems in the future.
Does anyone else have a final question? Otherwise, we can wrap up. Thank you so much for this wonderful discussion. I think what I'd like to do is just sum things up for us, and maybe you could help me out if there's things I leave out. So in addressing the health needs of women and girls in conflict settings, we need to make sure the decision makers know to prioritize women. We need to make sure there's data, appropriate data and thorough data, disaggregated as in separated by gender, make it gender specific. We need to empower local communities and give them the tools. We need to think outside the box, giving people these low-tech, innovative solutions. Involve women, involve men. Have I missed anything? No, we covered it. Thank you so much. It was a really, really interesting discussion. Thanks for making it out here. And thank you so much for your questions. A round of applause, please, for our panel.